Now, we're also going to have a Q&A session at the end, so you guys are more than welcome to ask any questions that you may have. It's going to be in the form of a chat. So you should have a chat box, so that way you can go ahead and ask your questions, and then I'll go ahead and respond. So before we get into actually how to achieve meaningful use, I kind of want to talk about some of the additional changes that they did, not just the objectives. So one thing that you guys are going to notice is, in any previous meaningful use stage for stage 1 and 2, it was broken up between core measures and menu measures. For stage 1, it was, now it's 13 core, it was 13 core, and then you had about 9 menu measures. You could select 5 out of those 9. And then in stage 2, we had 17 core measures. We also had 6 menu measures. You could select 3 out of those menu. So they've actually eliminated that structure. So there's no more core, there's no more menu items. Now it's just objectives. There is 10 set objectives now for stage 1 and 2. Now one thing you're also going to notice is now both stage 1 and stage 2 participants are going to be attesting to the same objectives. For 2015, they are allowing those who were scheduled for stage 1 to do some lower thresholds for some of the objectives. They also have some alternate exclusions that you can take just in case you weren't scheduled for stage 2. There's some objectives that do call for those stage 2 objectives, but those who are not, once again, scheduled for stage 2 for this year, they can go ahead and take that exclusion, and we'll go over what those exclusions are. Now, as far as for the rest of the years, for next year, for 2016, those who are participating in meaningful use for the very first time, they will be doing a 90-day reporting period that they can select. They will, however, be participating in the 10 objectives. They will not be eligible for those stage 1 alternates or those lower thresholds. All of these stage 1 alternates, this is only for 2015. So next year, everyone is going to be participating for the or attesting to the same objectives. Now, those who were scheduled for stage 2 next year, you'll be doing the full year of those 10 objectives. Then in 2017, that's when stage 3 will be released, and some software companies, including ourselves, will be being certified for stage 3 objectives. So in 2017, those who are scheduled for stage 3, they can go ahead and participate a 90-day reporting period. Once again, those who are scheduled for, if they participated next year for the first time for stage 2, it would be, or for any meaningful use stages, they would be doing a 90-day reporting period. They could also do stage 3 in 2017 for a 90-day reporting period, or continue with stage 2 for the entire year for 2017. Now, as far as when can you attest, you can start attesting January 4th. That is when the attestation portal is open. The last chance that you have to attest is going to be February 29th of 2016. After that, you will no longer be able to do the attestation through their attestation portal. As far as clinical quality measures, that is something that you are still going to be reporting to. It will still be part of the attestation portal, so nothing really has changed with clinical quality measures. Those are still the same. The biggest change really is just the core and the menu objectives that are now just plain old objectives. So I'm going to get started with the objectives now. So, and then you'll also notice here, and once again, this documentation will be available on our support website if you are on the latest version of MyVision Express, anywhere from, I want to say, the September version until now. When you launch MyVision Express, you should have a start page, which will feature, any news that we may have, the webinar, and of course, documentation will be on that website. So this will be available for you guys. Once again, you guys might notice that we have a new certification ID as well. So when you go through the attestation, you definitely want to use this ID. Typically in the attestation portal, it will give you an option to search for it. You just have to search for MyVision Express and then it should provide you with that certification ID. Otherwise, you have it right over here as well. So let's get started on Objective 1, which is protect patient health information. This is going to be the risk analysis. This is both in Stage 1 and Stage 2. There is no exclusion, so this is going to be the same for both Stage 1 and Stage 2 participants. This is just asking that you perform a risk analysis. Now, on the very bottom of this piece of the documentation, here is the link to the risk analysis packet. Otherwise, you can go to our website or support website and just type in under the search risk analysis, and then it should pull up that risk analysis packet for you. Any alternative options would be if you have like an IT person, definitely will help with filling out this packet. You could also contact your regional extension centers. There is one local for every state. They may charge you. I'm not sure of how much it is since there are so many different regional extension centers. You can also go to, there's other revenues or other resources out there to perform the risk analysis. I know that CMS, they have a packet that you can download as well. There's a company called Bits and Bytes, and they can go ahead and perform the risk analysis for you as well. That one I believe is $700 per provider and practice. But once again, there are different resources out there other than this packet. You definitely want to make sure that you have proof that it was performed prior to the attestation, and definitely during the participation year as well. It's one thing that auditors like to look at. So if you think just filling out the packet is enough, unfortunately it's not. You do have to have some kind of documentation proof that it was actually done during the reporting period before the attestation. So that's going to be Objective 1. Objective 2 is going to be clinical decision support. This does have two separate measures. You'll notice if you are scheduled for stage 2, this was actually core number, I want to say it was like core number 9 or 6. Clinical decision support. So the first one is implementing 5 clinical decision support interventions related to 4 or more clinical quality measures. So this means you want to make sure that you are doing a clinical decision for, let's say, diabetes, diabetic retinopathy, hypertension. Those are really good examples as far as how to set this up or what examples to use. The second measure is just asking if you've enabled and implemented the functionality of drug-drug and drug allergy interaction checks for the entire reporting period. You'll notice right below there is an exclusion for the second measure. So if your provider, your doctor, does write less than 100 medication prescriptions in that reporting period, so this year will be a 90-day reporting period, then you can go ahead and exclude from it. Otherwise, if you have Doctor First, which is the e-prescribe vendor that we partnered up with, and if you have that enabled throughout the entire reporting period, then you satisfy this measure. Now, if you are doing, let's say, another party, there's probably free versions out there. You can still do that. The only thing I would say or suggest is to make sure that you have some kind of proof that it was enabled throughout the entire reporting period. If you do it through us, we can easily give you that proof. Otherwise, you're kind of on your own as far as providing any kind of proof that you did have e-prescribe in this functionality. Another thing, too, is if you do go for another e-prescribe vendor, you want to make sure that they have this functionality as well. So it's something you can't hurt to ask if they're okay with this for meaningful use. Now, there is a Stage 1 alternate objective and measure. So this is only going to be for this year. Once again, those who are scheduled for Stage 1 next year, they're going to go ahead and do, Measure 1 and Measure 2, not this one. Now, the difference between the Stage 1 alternate and objective measure is Measure 1, it's asking for 5 clinical decision support. This is for Stage 2. For Stage 1, this is only going to be 1 clinical decision support role. Now, for those who are unsure on how to do this, and I just have here like a little screenshot of where to go, but let's go into MBE. So you're going to go to File, we're going to go to Setup, we're going to go to Exam, and then we're going to go to Alerts. So this is where you're going to go ahead and set up those 1 or 5 clinical decision support rules. To be honest with you, those who are doing stage 1, you might as well just do the additional 4, so that way you guys are all prepped for next year. Now, the only thing I have to really do here is select Add, which will go ahead and open up this line, and I have an example on top here. And the description can be anything you want it to be. So I'm just going to use the same example that I had here. So I'm just going to put glaucoma. Once again, the message could be anything you want it to be. So let's just say return in 6 months or so. Now after this, you can go ahead and specify an age range. So we'll do anyone who's over 40 years old. You can also specify an ethnicity and race. Once again, with this objective, they're not really looking at, what did you put for ethnicity or race. They're just looking for the functionality of it to see if you did set it up. Now, after I've done this, I can go ahead and select the Details button. Now, this is what is going to, or what I can specify, what will be the trigger for this message. So in this case, I'm going to do a problem, and I'm going to say glaucoma. So I just selected Add, and I'm just going to go ahead and type in glaucoma. So the way that this is set up right now, if I have a patient who is over 40 years old, and if I add this diagnosis of glaucoma into their record, then this message, return in 6 months, will pop up. This is all you need to do. As long as it's set up like this, then this is perfect. Once again, I'm huge on audits, so one nice little thing that you can do to kind of prepare yourself for that audit is I would take a screenshot of this being all set up. Make sure that you have, I don't know if you can see my mouse here on the bottom right corner, make sure that you have like a date stamp in some kind of way. Some auditors, they like to see that. They may ask for that. It's definitely passed audits before. So nice little tip for you guys. So that's going to be objective number 2. Now, objective number 3 is going to be computerized provider order entry. So in a nutshell, this is just asking that if you are prescribing a medication, to actually prescribe it through Doctor First or e-prescribe. Once again, if you guys go with like a different third party that's not Doctor First, you guys will have to calculate that on your own. Otherwise, this will calculate pretty much on its own for us, for My Vision Express. So once again, if you are going to be prescribing a medication, this does exclude any outside prescriptions, so those doesn't count. If the doctor is going to be prescribing that medication, just do it, through e-prescribe, and then that way it'll go ahead and calculate it. Now, for stage 1, there are some alternate measures and exclusions. So for computerized provider entry, you have here alternate measures. Oh, actually, this is wrong. This is going to be for, oh no, actually, this is right. So it's broken up into 3 different measures. First one is for medications. The second one is actually going to be for laboratory orders, and the third one is going to be radiology orders. For both stage 1 and stage 2, this one you can attest to the alternate measure because this relates to your scope of practice, but no one's really doing laboratory orders or radiology orders, so you can exclude from these 2, and that'll be just fine. Now, as far as number 4, objective number 4 is e-prescribe. So essentially, objective number 2 or 3 and 4, they're going to be done exactly the same way. You just need Doctor First or e-prescribe, and just write your prescriptions through Doctor First. It'll calculate it on its own. Now, with objective number 4, you have, it is asking for those who are scheduled for stage 2 to perform more than 50% of your prescriptions through Doctor First. Now, for stage 1, it's 40%. There is, however, the exclusion if you write less than 100 prescriptions during the reporting period. So for both objective 3 and 4, if you write less than 100 prescriptions, you're eligible for the exclusion for both. Now, objective number 5 is going to be health information exchange. So this one is asking if you are going to be referring the patient out to another provider. What it's asking for is for you to create a transition of care summary and to upload it or provide it to the patient. This has to be done for more than 10% of the patients that you refer out. and that's highlighted right over here. Now there is an exclusion. So if the doctor refers a patient out less than 100 patients during the reporting period, then you are excluded from the subjective. There is a stage 1 alternate exclusion. So you can exclude for the stage 2 measure that requires electronic transmission of the summary of care document if you were not scheduled to demonstrate stage 2, which does not have an equivalent measure for stage 1. So once again, those who aren't scheduled for stage 2, they can go ahead and exclude this. Now, just to kind of show you really quickly where you would have to go to perform this objective and to kind of see where the denominator is being generated from, so that way you guys can know, how many patients you referred out. So the refer to and reason in the assessment tab of the exam, this is going to be your denominator right over here. So the moment that you record this, this is going to generate that denominator. Now, to satisfy the numerator, we're going to go to the Health tab. And we're going to go to the sub-tab HL7 CCD CCR. And then what you're going to do is select Transition of Care Summary. After that, and I have one generated here, after that you can go ahead and select Upload, and that will go ahead and count for this objective. Now, number 6 is going to be patient-specific education. Those who are scheduled for stage 1. Patient-specific education was an objective, a menu objective. So it was something that you could select to attest. Now, if you do not intend on selecting education as your objective, then you can exclude it. If you were going to do education, then I would not exclude it. To be honest with you, because of the way that the menu items for stage 1 were structured, providers were almost forced to do education because of the fact that they didn't want you guys to take any exclusions. For those last 9 menu items, they were kind of forcing you to select the ones that you can actually do without an exclusion, and then the rest you can go ahead and exclude. If for any providers, if you decided to take this exclusion, I would not recommend it, because through an audit, they might kind of find it questionable. They might ask, were you eligible or could you perform this? How many were you eligible for the exclusion? So I would go ahead and perform this one. As far as for, stage 2, this is also just looking at office visits. And what I mean by that is it's looking at the procedure codes. So if your practice for the majority of it sees only, let's say, 92004 codes or 92014 or even S codes, whenever you bill that or add that into the exam, it will not count towards this objective, which is not a bad thing. It just means it's not an office visit. But the moment that you guys do put in, let's say, a 99 code, then it's going to go ahead and generate that denominator. After it's generated that denominator, we're going to go back into the exam here. Let's go to the assessment. And what you'll just do is select the education checkbox on the very right below Vision RX. Now, education can still be provided in any manner. So it could be verbal, it could be a pamphlet, it could be a video. As long as you go in here and select the type of education that you provided, you can also have a source here or a delivery, so how you provided it to this patient. And then after that, you'll just select education provided. This is going to be key. Selecting which education you provided to them is just good documentation. Once again, especially during an audit, if you ever go that far into seeing an example of a patient. So once again, selecting this for any office visits, once again, any procedure codes that are billed like 99 would go ahead and count towards this objective. Now, objective number 7 is going to be medication reconciliation. So this is the opposite of the transition of care. This is if a provider referred a patient to you. Now, there is an exclusion if you were not the recipient of any transitions of care during the reporting period, you can exclude it. For those who were scheduled for stage 1, just like patient education, if you did not intend on selecting this as a menu item for stage 1, you can exclude it. This, just like education, I would recommend actually attesting to it. Even if, the exclusion is you were just not a recipient, this is one of those objectives that you were almost forced to do just because there was no other objectives that really related to your scope of practice. Now, for this one, it's a little tricky, but for those customers or for those patients who were referred to your office from another provider, and it would have to be, a legit, referral, not just, oh, go see your eye doctor. It would have to be an actual referral. But pretty much when you do have a patient who's referred to your office, what you're going to have to do is actually import a clinical summary or a CCD from that other provider, which they should have in some kind of way that information provided to you. They can email it to you as long as they have an EHR. They can email you that CCD. The patient could have it on a USB drive from the provider, and then you'll be able to import it on here. Now, once you do have that documentation or that CCD and it's on your computer, you can select Import, which is on the right here, and this is going to generate your denominator. After I found my file and imported that CCD, it'll appear here. Once again, will generate my denominator. Then my numerator will be generated when I go to medications after I've reviewed the clinical summary from the other provider, and you're going to indicate here that my medication list was reviewed. Once again, if you are not the recipient of any transition of care, then you can exclude it. I want to say a majority. Very rarely do I see providers actually getting, transition of care to them. Now, objective number 8 is going to be patient electronic access. This was if you were in stage 2. This was core number 7, and it does have 2 measures. The first measure is just asking that for more than 50% of your patients that you create a clinical summary and provide them with electronic access. To satisfy the first measure, we're going to go back to the Health tab. We're going to go to the HL7 CCD CCR. To satisfy this, you're going to select Clinical Summary, and then you're going to go ahead and upload. This will go ahead and satisfy Measure 1. Now, Measure 2 has changed since it originally came out like last year. It used to be for the second measure, for those patients who had a clinical summary uploaded, it did ask that more than 5% of those patients to go into this portal and download their clinical summary. Now it's no longer more than 5%, it's just one patient, at least one patient downloading their clinical summary. Now the exclusions here, there are exclusions, but to be honest with you, none of these exclusions really count. Or not really any of our providers will be eligible for those. So I would ignore the exclusion, to be honest with you. And then you have, of course, Measure 1, Measure 2. Now, those who are scheduled for Stage 1, there is no equivalent measure in Stage 1, so you can take this exclusion. Now, number 9 is secure messaging. This has also been changed. This is originally a Stage 2 objective. It was a core measure, and it was core measure number 17. Now, just like the previous objective, it did ask for more than 5% of the patients that you saw for them to be able to go into their portal and send you a secure message. This is now only asking that you have the capability of secure messaging. For those who do not have Global Portal, you definitely want to make sure that you do have that active, because that will give you the capability for secure messaging. Global Portal is free. So if you are web hosted, you can actually go into the company settings and actually enable it yourself. Now, one thing that I do want to mention, though, is if you have not enabled it already, but you're going to, whomever you're signed in under in My Vision Express, that person will be admin. So I would make sure that, if the provider wants himself to be or herself to be the provider or to be the admin, make sure that they log in under their own username and password and then activate it. Otherwise, office manager, whoever is head of meaningful use, then you can make them the admin. Now, to enable it, you're going to go to Systems, and then right over here you have a section called Global Portal. Now, obviously, this is activated for me. Otherwise, this is going to be a button that's going to say Activate Global Portal. So, once again, for web hosting, you can go ahead and do that. If you're not web hosted, if you're local, then I would suggest contacting our installs department, and you can contact them at installs@myvisionexpress.com, and they can enable it for you. So that's going to be secure messaging. Last one is going to be public health reporting. This is really easy. There are 3 different measures. So the very first one is going to be for immunization registry reporting. The second one is for syndromic surveillance reporting. And then the last one is specialized registry reporting. If you have never done any one of these 3, you are eligible for the exclusion. It is something that I confirmed with a consultant. So that way you guys can exclude from all 3, since none of them really relate to your scope of practice. So that is our 10 objectives now for meaningful use. Once again, for this year only, we do have that stage 1 alternates for those who were scheduled for stage 1, but after next year, or starting next year in 2016, you'll be doing stage 2. All of the stage 2 requirements. They'll no longer be those stage 1 alternates. Now, last thing I want to show you guys is actually going to be an MVE. So currently right now we don't have the report that reflects those changes. However, I do want to show you what we did so far. This is not going to really be released until, I want to say, beginning of February. Remember though, you do have until the 29th of February to attest. Now, just because the report that reflects those new changes are not available just yet, you can still attest. So let me first show you the new report so that way you guys can take a nice little peek at it. And then I'm going to actually show you, generate the normal reports, and I'm just going to show you which objectives we're going to go ahead and eliminate when you want to go ahead and attest. The calculations are exactly the same. This is really just a cosmetic change as far as the reporting goes. So we're going to go to File Reports, and we're going to go to Meaningful Use Reports. One thing that we did do is we actually separated the clinical quality measures and also the objectives, the new objectives. So they are 2 separate reports now. So let's go back to Meaningful Use Reports, and we're going to go to Core Measures. This is what's going to contain all of the different reports that we want to look at. Now, the drop-down is the same. You'll see, though, that there are 2 additional reports. So we have 2015 Stage 1 alternates, and then we have 2015 Stage 2. So once this is released, this is what you want to go ahead and select. And then you'll see here it does reflect all of the objectives, and then below you'll still be able to indicate which ones you're going to exclude from, which ones you're saying yes to, and it will give you your target percentages if you passed or failed, and then the percentage that you actually achieved. You still have the explanations right over here too, just in case you are missing anyone from the numerator. This explanations button will tell you how to fix that. Now let's go ahead and look at the old stage 2. And then of course you can do the same thing with stage 1 as well. So it's going to be a little bit of kind of picking from these objectives, but looking at this right over here, we want to keep core 1, core 2, because these are still CPOE, e-prescribed, so this has remained. We can go ahead and actually eliminate, before I generate it here, let me eliminate it here. You can remove an objective from here. So we can remove patient demographics, vital signs, we don't need that anymore, smoking status, let's remove clinical summaries, let's remove clinical lab test results, patient lists, preventative care, the rest we can keep here. And then let's go to our menus, and the only ones I really want to look at is just these 2, which you can exclude from anyways. So once again, if we're looking at stage 2 here, we're looking at core 1, core 2, core 6, 7, 9, and then we've got 13 down to 17. And then this will go ahead and give you the numbers that you need. Same thing with stage 1. You can kind of look through here and you can go ahead and remove the ones that no longer are valid. So patient list, medications, medication allergy, demographics, vitals, smoking status. This one we can remove. Implement at least one clinical decision support rule. Provide patients with timely electronic access. You can remove that and keep 14. So that is all I have for today. Once again, this webinar will be posted later on. We'll have the documentation as well posted, so that way you can see all of the objectives and how to achieve them in My Vision Express. Now at this time, though, I'll go ahead and open up the chat window here. So if you guys have any questions, you're more than welcome to ask.